There is breaking news at home. A new report that has just come off embargo from Ontario's patient ombudsman revealing a sharp increase in complaints linked to inadequate hospital staffing. CBC News got an advance copy of the report, and our senior reporter Mike Crawley has been looking through so he can give us the breaking details now that it's off embargo. Give us the headlines, the top line from this report, Mike.
Well, Heather, what this is doing really is drawing a link between the stresses and the strain that healthcare workers have been under during the pandemic and the shortages of staffing that we're seeing in hospitals, and linking that to this surge in complaints from people about how they're being treated. And so I'm not talking about the medical treatment per se. It's really more about how people interact with staff at hospitals when they arrive at a hospital or an emergency room. Tensions can be high. And so if you combine the fact that healthcare workers have been under such strain, working so hard for such a long time during the pandemic, add that in together with patients feeling under stress. The Ontario Patient Ombudsman's report has seen an increase in complaints related to things like courtesy and respect. I spoke to the patient ombudsman about this. Take a listen.
One of the complaints that we really have never had as much in the past as we do now, which is around courtesy and respect and compassion that patients and residents are feeling from their healthcare providers. So that's a new one. So that's a signal to us that it's finding its way into the actual interactions of people at a very personal level.
So a 43% increase in the number of complaints coming from people at hospitals about this kind of lack of respect or courtesy, and it's happening in particular in the emergency rooms.
So not just anecdotal anymore, hard data in this report. What's going to happen with the findings, and how are they going to act on this report?
Right, so there's basically two things that this report can do. So the Ombudsman's office, when they receive a complaint, they actually deal with it in real time. So they work with the hospitals or the long-term care home where the complaint happened and with the patient or the resident to try to resolve things in the moment. But the trends that this report talks about, the Ombudsman told me that he hopes that patients will be pleased that this is being talked about and that the healthcare workers can actually draw some lessons from it. So he said it's not about naming and shaming and blaming. In fact, the hospitals where these incidents happen are actually not named in the Ombudsman's report. But the hope here is that the hospital workers and the hospital management will be able to learn some lessons, and that the insights in the report and these trends can lead to improvements in the way that people do their jobs in hospitals and in long-term care.
Thanks so much, Mike. Appreciate it coming in with that breaking report. Mike Crawley.